Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
You're making me laugh every time you come on the show. Do you know someone said to me, Anita, you laugh too much with Dr. Mencia.
We have fun.
We have fun, but isn't that why you and I are
oh
healthy?
My God, what a beautiful therapy.
What
the
does
best
laughing
therapy.
do for a body?
Exactly. Yeah. Imagine me in my lonely apartment and sometimes I just go and laugh out loud and then sound like a monkey.
Your neighbors are going to think
my next door neighbor go like, man, what kind of pet this guy has in there?
That's right. Who did this? Okay, so I said to Dr. Mencia when he came in, okay, what's our topic today? What did you say?
Spring cleaning.
Spring cleaning.
Spring cleaning.
I love spring cleaning.
Oh my God.
Do you do spring cleaning?
Every year I do spring cleaning. I like to go through my office and organize and get things in place. And in my apartment, my home office, I just get things organized and things that need to be thrown away, let's throw it out. And a lot of people should take, just like we take our birthday to get the mammogram and the pap smear and blah, 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 this thing that people tend to do during their birthday. Spring cleaning should be used as a time to clean up your cabinet. Go through your medication. What is it that you're using, what you are not using, why you are not using it. And make notes because as you move down the future of that given year, if you go to a doctor and then you develop sinus infection and the doctor say, okay, let me give you an antibiotic. If you have had it in the past and you have your list, you say, oh, you gave me Cipro and it did not work for me. You gave me Cipro and it gave me a horrible diarrhea. So, give me a different antibiotic. So you know what not to take for, a given infection. And what works good for you. I had a patient that came yesterday, a young guy, 39 years old. And I have not seen him for 2 years. And 2 years ago, he developed a sinus infection. And he came back and he said, Dr. Mencia, just go back in the record to see what you gave me because whatever you gave me worked really, really good that time. And I say, no, I'm not going to give you that. He said, look at me with that face and say, why, Dr. Mencia? It works well. Say, I won't see you for 2 more years. So I have to give you something. No, but I did give it to him, of course.
But it's funny you should mention that because when we sold our house when we moved, and I brought everything with me, and I was going through, this is a couple of years ago, there were medications, 5 years old, 8 years old. I thought, what am I doing with this? You don't throw out that stuff somehow. Why?
And then people
Ridiculous.
Think that, hey, it's expired, but it probably still works. So, and the thing is, medications, prescription meds, they are chemical. Chemical that are made in a laboratory, and just like food and other products, they have what we call a short half-life. So you put something in a shell. If we say the half-life is 3 months. That means 3 months from the day we produce that product and put it on a shelf, put it away, half of the product still active. So if you're getting, let's say, 100 microgram of thyroid medication, and you put it away 3 months from now, it's only 50 microgram. Even the number in the bottle say 100, you don't have 100 anymore. Now you have 50. You go another 3 months, and now you only have 25. You go another 3 months, now you have 12.5. So the half-life is telling you how much active product remain on that medication. The same thing, we have cream sometimes. And we get cream and we use it for a little rash and what have you. And then we put them away for years and years. And I say, oh, I remember they gave me this cream 40 years ago. You go and put it on.
And you go back and use it. It's still sitting there.
Yeah, it's sitting there and it's, probably 1% active compared to when you had it 40 years ago, if anything, or probably just totally inactive. And then you go to the doctor and say, oh, I tried this cream. It doesn't work for me.
But I have a question for you. Sometimes, because of being in our magazine business, I have companies send me all sorts of creams and different things to try. And sometimes they're just in packages I've never opened and they're sitting there. And sometimes they're 3 and 4 years old. Do you mean that they're not good even though they've never been opened?
They are not good anymore.
No kidding. You throw all of them out?
All of them go to the garbage.
Spring cleaning.
Dispose of them.
Boy, Bill's going to love you because he thinks I have too many things that I keep. So
I do keep so many things too. I have so many things I keep with me, And, the garage, you should go through the garage and see what you have there. You have stuff that, that might be nice and you might want to pull out. And I like, in my apartment, I like to rearrange things, So when I'm cleaning, I take the furniture. I like to move them around, The bedroom is too big and the bedroom says it's too big and my bedroom is too small, so I cannot move it around. It is what it is. But you have to go through the cabinet and check.
Wait. Now I got another one. The cabinet refrigerators.
The refrigerator.
Oh my God! Yeah. Seriously, there are things that I've bought that they're good things. I mean, they're like my flax seeds. I'm using that like crazy, like you told me.
Mm-hmm.
But there are other kinds of foods that people send me. I mean, they're not. They're like jars of this or jars of that, and they're just sitting there. Sometimes they've been there a year. I mean, they're probably still
same
okay.
Shelf half-life.
Throw them away?
Shelf half-life. Yeah, if it's too old, just throw it away. You're taking such a risk of getting sick with those products.
Even jellies?
Even jelly. I mean, imagine mayonnaise. When you use mayonnaise, you open the jar and you use it on something.
Right.
Whatever you put it on, if you put that away more than 24 hours, it can be detrimental to the guts. You
mean if you leave it out? No, you can't leave it out.
Yeah.
No, but it's funny. I was thinking about my refrigerator. There are things in there that I have had for a while, and I don't know why I keep them. I think I'll use them sometime.
Yeah.
They're sauces and little things in jars, and so I'm going to clean out I'm going to do some spring cleaning today. And Bill say, "What are you doing?" I say, "Well, Dr. Mencia said I should do my spring cleaning."
I had a patient that broke a tooth. Say, how you break a tooth? Biting on a piece of bread. Say, what? Biting on a piece of bread? How are you going to break a tooth biting on a piece of bread? Oh, and it was just there. It was an old piece of bread. It was there in my house. I didn't want to throw it out.
That's funny.
So I didn't want to throw it out. So she got out the bread and she bit on the bread and broke a tooth.
That's funny. But that's true. I think we all are like that, especially if we come from a family that... See, Bill doesn't come from a family like that. He won't even finish a jar and it's thrown away. He doesn't have that I have. My mother used to scrape the jar out and save the last thing.
My family was the same way. That's how I grew up.
Somehow they didn't have anything anyway. Whatever happened, he didn't learn that. And sometimes we have a little bit of meat left after dinner, and I went to put it away. He said, "I threw it away." I said, "What do you mean you threw it away? This can be eaten tomorrow." But he's not going to be a problem. He throws a lot of things away. He's the opposite of what you and I are. But spring cleaning, I like that. Well, let's go back to the supplements. I've got supplements for a long time. I have actually wonderful, not cod liver oil, but one of the omega oils.
One of those fish oil.
Probably is 2.5 years old. I mean, I use it, but it's a huge bottle.
It's garbage.
It's garbage.
One of the
but
worst.
It doesn't say. Wait. On the.
It had to say expiration date.
Expiration. It does, but it doesn't.
Expiration day is like absolutely don't use it after this day. But short half-life, you go and research what is the short half-life. It'll let you know. And some things have short half-life of 3 months. Some can have it of 6 months. Some can have a short half-life of 9, 10, 12 months.
It says shelf life on it. It does?
Short half-life.
Shelf half-life.
So it's like putting it on the shelf and wait to see when half of that product is still active. That's how you determine the short half-life.
Okay.
And it's usually done by the laboratory. Now, that's one of the biggest gimmicks when it comes to supplements. And you're going to have Nicole on the Cure Symposium. But one of the bigger gimmick is when you buy a big jar of, let's say, fish oil, and it has a year's supply of fish oil in one bottle.
Right.
So you are wasting money. It's better to buy 1 to 3 months, no more than 3 months of fish oil or any supplement, if you're going to use it daily. But if you're going to buy 3 months, if it's something that you say, sometimes I use it, sometimes I don't, get a week or just get a month. Don't go beyond a month. It's a waste of your money. You're wasting money.
Isn't that interesting? This is a great show this morning.
Multivitamin is the same thing. You get now the multivitamin going bigger and bigger jars.
Right.
Like, they have personal side, family side, community side. They say, ooh, I'm going to buy the community side. I'm going to save, so it's a penny a pill.
You're right.
It's a waste of money.
Now, see, this is so important. This is absolutely the best thing, spring cleaning.
The same thing also goes with when you buy product for the skin product. Whether you buy it from the doctor's office, we sell the Obagi line. And when you buy the product from the office and you don't use them, after a while you have to just throw those away and get new one. And I use a lot the vitamin C, the concentrated vitamin C. We have the 5%, 10%, and 15%. And I like it because it comes in this tiny little bottle. So you use it. But if you notice, I'm always looking at the little bottle. As you are using it, you see the oxygenation going on in there. So every time you open a product and you use it and then you close it, you allow oxygen to interact with the product. And that's how the half-life of the product start decreasing.
I've never heard anything like this about
So a lot of the facial product that you use, they are good. And that's why sometimes you get something new, you get a new joy, you say, oh, let me try this product. When you get it, you love it. You say, oh, wow, this is great. And you start using it, then you start shying away from it. Then you want to go back, and it doesn't work anymore. And it's because you went past the short half-life already. So if you buy small quantity, and if you are not using it, then it's easy for you to throw away because it's not that expensive. Then.
Okay, I just bought at your recommendation D12. What is it? It's called D something. I'm using the D3, and that's on. I think they're only 100. No, maybe
100
60.
capsule.
What?
No, 100. Yeah,
100?
yeah. I got the same bottle
I'm
you
giving
have.
it to Bill.
Beautiful.
Also, I'm giving it to me now.
Yeah.
Can I just keep taking that? Because you said I didn't.
Well, no.
You want me to keep taking it?
No, because that is 5,000 units. So I want you to take it until I recheck your vitamin D level. If your vitamin D level is high enough, because high concentrated vitamin D, we use it. Like I always tell my patient, this is only to fill up the tank. Your tank is empty, so I need to fill it up. Once you fill up the tank, then you can get any vitamin D over the counter. But the one that I sell at the office is highly concentrated vitamin D.
But what will happen if I don't need it? Is it bad?
No, but it's a waste of your money. You already fill up the tank, then you can just take it.
No, but your vitamin D is very inexpensive.
Very inexpensive, and it's good quality. Good. And what I tell some of my patients that say, no, Dr. Mencia, I don't want anything from the street. I want to take this one. So I tell them, okay, take it 3 times a week instead of every day now. So we go to Monday, Wednesday, and Friday. That's what I've been doing with some of my patients because they don't want to come off from it. And, I try to be honest with them. I say, there is no need for you to take it every day. All my patients that have multiple sclerosis, Parkinson's disease, I look for their vitamin D level to be above 60 in the level, the result when I get it back. And I make sure they keep it above 60. So, vitamin D is very, very important. And one of the research that was done last year on multiple sclerosis, it showed that the high level of vitamin D is very protective of those patients to prevent relapse of MS. So a lot of my patients with neurological condition, I shoot for high level. And, it's a good time to say thank you to my two dietitians, Nicole and Courtney, because with them we have been able to research a lot of products that I would have never been able to do by myself. Impossible. Them being nutritionist and dietitian, I'm able to go into the and research for products that have good prices but excellent quality. And that's what we try to, sell at the office.
Yeah, and I've been taking it religiously, and I've been giving it to Bill. You never told me to do that, but I said, well, Bill, it's very important. Mm-hmm. But we could still keep taking it, but it isn't going to hurt us. That's what I want to make sure.
Right. But it is important. Your question is good because there are certain vitamins that you cannot keep taking without checking the level or without thinking of what the concentration, what are you taking. For example, vitamin A. It's important. It's an important supplement, an important vitamin for you to have in your body. We use it for a lot of chemical reaction in the body. It's important for the for vision. But when you overdose with vitamin A, it can produce blindness.
Wow.
So, vitamins and supplement is a multi-billion-dollar market. Especially here in the United States, multi-billion-dollar market. Here and Europe also is very much into vitamins and supplements, and people buy it. And you have to sit down and look and say, well, if I'm taking a given vitamin, let's say you are analyzing your vitamin A intake, how much am I taking from my multivitamin? How much am I taking from this other? Because a lot of them say, magnesium, calcium with vitamin A and vitamin D, blah, blah, blah. So multivitamin. Vitamin fish oil with vitamin A and vitamin D and blah, blah, blah. So you have to say, okay, how many of these things say that they have vitamin A? And what is the concentration? And then you add that up, and then you know the amount of vitamin A you take. So vitamin D is the same way. If you're taking vitamin D about 800 to up to 1,000 international unit of vitamin D, that's an average over-the-counter level that is acceptable. When you go over 2,000 on vitamin D, then you have to make sure that you are checking your level. Another thing about vitamins and supplements is that just like certain medication work very well in one patient and not in another, vitamins, certain products, certain line of product will work very well on some patients. I have one of my patients that take vitamin D from a anti-aging company. Both you and I both know them very well. And her levels are great. She has a good level. I say, wow, whatever you're taking is working great. I have another patient that get the same vitamin from the same center, anti-aging center, and her level will not go up. And I say, you know what? Why don't you try my vitamin? Let's do an experiment. Try my vitamin. Let's see what happens, because your level is not moving. You're still low. And she was taking it like for over 9 months. And she switched within 1 month. We checked the level, and the level started to go up. So, why those vitamins from that particular company was not working, we don't have the answer. It could be the composition of that vitamin D is her body, her gut cannot absorb it. And maybe the composition of mine. It can happen in both directions. It can be, either way. So we always check the level, whether you buy it from my office or outside. All of my patients, every 3 months, I'm checking the level to see where they are.
Okay, well, I have to come in and have you do it on everything that I'm doing again. But I want you to ask you about the, if you're eating, though, certain foods that have a lot of that vitamin in it, can you overdose it that way then?
Rarely, no. And that is, any dietitian, any good dietitian will tell you. Because you have to be careful with the dietitian, especially when you go out in the street, that they don't work under a physician, because all bets are off now. And they usually make a good living out of selling from the multi-billion-dollar company of vitamins and minerals. So When you go to a dietitian, they'll start pulling products and say, here, buy this, buy that, buy that. And you end up with a shopping bag of vitamins and product that you're really not going to take. When it comes to vitamins and minerals, including what I have in my office, there's no exclusion here. What you get from nature is the best. Mother Nature is still the best. So if I'm going to get my vitamin A, then I get my carrots and I eat. And, if I eat enough of the product that I need, then I should be okay. If you need iron supplement, dark green leafy vegetable will give you, if not iron. And it's always better than when you take iron pills, less constipation and all of that. Because with those leaves, you are taking, you're taking a lot of fiber, so you get a good bowel movement. Where when you take the iron, but a concentrated one, it tends to constipate you. And if you take iron, you have to take it with vitamin C, because it had been proven that vitamin C helps the absorption of the iron into the gut. So,
my mother was funny. My mother was a very good cook, and she, being Hungarian, she absolutely made lots of soups and all, but she really believed in all the food. That's what she said. Eat the right food, and then you don't need all this other. But
growing up in Hawaii, I never forget my mom. If one of us got sick, and it was 9 of us. If one of us got sick, a little cold or something, she would go to the backyard, to the back of the house, and she will grab a few leaves, and you see her just grabbing leaves like if you're at the supermarket. Grab a few leaves, wash them, boil water, make some tea, put some cinnamon in it, cinnamon stick, make some tea, and we will drink that stuff. Or grab some ginger and smash it and throw it in there and make some tea. And that thing is, oh my God, that was like, bring you back from the dead.
Right. Well, I think it's really important. I wanted to just compliment you, though. You told me I should be having flax seeds. It would help my blood pressure, and my blood pressure just went in the other day, and it's low. But I'm eating a lot of flaxseed. I actually like them. They're very tasty.
I like the flaxseed.
I do. I put them on sometimes you're going to laugh. I take a spoon of flaxseed without anything to it. I can chew them up now. I do have, they get caught in my teeth, but I have now, I guess it was Mike that told me to get one of those, let's see, what is it? It has water in it, and
the toothpick, the
pick, right? The pick, water pick.
The water pick,
and it just pulls them out. But I do like those, and I bought them at a health food store, and they're like golden, and they're beautiful, and they're very healthy, aren't they? Because everything I read, when you start looking at a lot of foods that you're buying, flaxseed, they have flaxseed in a lot of this
exactly.
stuff. I can't overdose on flaxseed, can I?
No,
okay.
no.
Because I'm really liking it.
Yeah, I like it too, and I put it on everything. Cinnamon, I take cinnamon.
Cinnamon too. I love cinnamon.
It's good to lower the calorie count on whatever you are eating. So cinnamon is good. And I tell my diabetic patient, because they say, but I have to have some sweet. I say, okay, what you going to have? If you're going to have a piece of cake or ice cream, take some cinnamon and then mix it with cinnamon. And now you're cutting down on the amount of calorie that you are taking, and you're still having some...
Isn't that interesting that cinnamon has that effect? Mm-hmm. I love cinnamon. I'm really big into cinnamon. I can take yogurt.
Let's get the phone number.
We forgot. I am so
we had so much fun.
I
this
know,
is so
but
good.
You're right. You're the only person I do this with. Usually I'm giving phone numbers, but I don't never want to stop you. Okay, AGI Medical and Dental Centers, Fort Lauderdale, open today. Dr. Mencia is gorgeous. He's going down there right now, and it's on Commercial Boulevard. The phone number is 954-489-1345. That's 954-489-1345. And they do have a wonderful, gorgeous new office in Boynton Beach. And if you want to go there, they're not open today, but their phone number is 561-270-6494. The most important thing I want to tell you about this is that they do have home visit services available for homebound patients. And they, of course, Medicare, most major insurances are accepted. And you can get on their website, and that's agifl.com. AGI stands for Adult Geriatric Institute, and it's agifl.com. So there, I did it.
Thank you. I have last Sunday morning, I have one of my dentists that came in. The operator called and said, "Oh, we have a dental emergency, and they want to be seen today." So they called the dentist, and the dentist called me and said, "Will you come and open the office? We have an emergency." So of course, I'm there. I'm there on Sunday anyway, so let's go. Let's get to work. So I went and we opened the office. The patient said, when you and Anita are on the air, you have to say that if it's a dental emergency, it is really 7 days a week because you guys will, go out of the way. And a lot of time, if it's something that the dentist feel that, let me at least call some antibiotic and some anti-inflammatory to hold you until the next day, we will do that. But, during working hour, because, all of my dentists, they have family and what have you. So, during working hours for emergency, we'll be happy to go in and open the dental.
Emergencies that Richard's telling me we have to go. That's the end of it. It was wonderful.
That's why I don't like him.
I know.
He always called me off.
Okay, one thing I have to say fast. Dr. Mencia, we have him as the book of the month. You need to make sure you read that book about kidneys. It's a fantastic book.
It's going to be on the magazine this month.
Oh, yeah. Cover of the magazine.
Yes.
Okay. Thank you, Dr. Mencia.
Thank you, Anita.
Go have a great day helping people today.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM. Welcome to The Wonderful World of Wellness with Dr. Andy.